How do I treat a puncture wound on my dog's paw? If your dog has a puncture wound on their paw, it can be concerning. Knowing how to treat it properly is essential for their health. Let's go through the steps you should take to care for your furry friend. First, if the wound is bleeding, you need to control it. Use a clean, absorbent cloth or gauze and apply gentle but firm pressure. Keep the pressure on until the bleeding slows down or stops. If the bleeding is heavy or does not stop, it is important to seek veterinary care right away. Once the bleeding is under control, you will want to clean the wound. Use a sterile saline solution or a mild antiseptic that is safe for pets, like diluted chlorhexidine. Gently clean the area to remove any dirt or debris. Avoid scrubbing, as this can cause more damage. Rinsing the paw with clean water can also help flush out contaminants. If you see any debris or foreign material in the wound, try to remove it carefully. However, do not attempt to take out anything that is deeply embedded, as this requires professional help. After cleaning, apply a thin layer of pet-safe antibiotic ointment to the wound. This will help reduce the risk of infection and support the healing process. Next, you need to protect the wound. Cover it with a sterile, nonstick dressing. Then, wrap the paw with a self-adhesive bandage or veterinary wrap. Make sure it is snug but not too tight. You should be able to slip 2 fingers under the bandage to ensure it is not cutting off circulation. Keep an eye on the wound for any signs of infection. Look for increased redness, swelling, discharge, or a foul odor. If your dog seems to be in pain or has a fever, contact your veterinarian right away. It is important to change the dressings regularly. You should replace the bandage and dressing daily or as your veterinarian advises. This keeps the wound clean and allows you to check for any changes. Dogs often lick or chew at their wounds, which can delay healing. To prevent this, consider using an Elizabethan collar, also known as a cone, or other deterrents recommended by your veterinarian. If the puncture wound is deep, ragged, or bleeding heavily, or if your dog is limping or in pain, seek veterinary care immediately. Your veterinarian may need to clean the wound more thoroughly, prescribe antibiotics, or place a drain if necessary. Finally, be sure to follow any aftercare instructions provided by your veterinarian. Complete any prescribed antibiotic courses and keep your dog from walking on rough surfaces or engaging in strenuous activity until the wound heals. Puncture wounds can lead to complications, so early and proper care is essential. Regular monitoring and follow-up with your veterinarian will help ensure a smooth recovery for your dog.